All right. So we're going to start with endocrine. So the first one on our endocrine list is growth hormone deficiency. Anyways, so growth hormone deficiency is whenever you're going to have poor growth and short stature. You're going to be built short. Essentially, that's the same thing as dwarfism. That's what I read in the textbook. So everything that I'm going to be showing y'all is straight up from the slide and maybe like a little bit more from the textbook because I felt like it was important. So the pathophysiology behind it or whatever. So growth hormone is important for postnatal growth. So once you're born, the growth hormone is really important to make sure that the baby grows the right way. So if you have inadequate secretion of the growth hormone from failure of the anterior pituitary. So the anterior pituitary gland is what controls the growth hormone. So if you don't have enough growth hormone, it's because there's a problem in the anterior pituitary. So causes could be tumors, congenital defects means you're just kind of born with problems, or trauma. These things aren't necessarily super important. Signs and symptoms. So their height will be below the 3rd percentile on the chart. Like where you measure for like weight and length, it'll be below the 3rd percentile. And their weight to height ratio will be really high because since they're really short, their weight's going to be more. So it's going to be a higher ratio. They're going to have a lot of abdominal fat because if they're short, they're compressed. So they're going to be bigger. So they'll have a childlike face with a large forehead. They'll have a high-pitched voice, delayed sexual maturation because everything's short. Everything's not growing the right way, so they'll be delayed. So like the boys will probably have a micro penis or undescended testes, and obviously just delayed growth in general. So for lab diagnostic testing, to rule out chronic illness, you have to be, you want to do all of these tests. So you can test the bone age through like x-ray and stuff like that. You have to be 2+ deviations below normal. A CT or MRI will rule out tumors and structural abnormalities. And then pituitary function testing, that will confirm the diagnosis. So when you do this will confirm if you have the growth hormone deficiency. So you're going to provide a growth hormone stimulant like glucagon, insulin, levodopa, and it will release a burst of growth hormone. So whenever you do that, the peak growth hormone levels, if it's below 7 to 10 microkilograms within a milliliter, and you have to do 2 tests to make sure that's a confirmed diagnosis. So this is how you do it. You provide the growth hormone stimulant, the insulin, the glucagon, and then whenever it reaches its peak levels, if the peak level is below 7 to 10, do it again. And if both tests is below 7 to 10, that's a confirmed diagnosis for growth hormone deficiency. So whenever you're doing the height to weight to height ratio, if you're 3 and above, you're going to use a stadiometer to measure the height. It's the one where they stand, and then it has a little thing that comes up over their head. And then for the little ones, you're going to put them on the little wide bassinet thing, and then you're going to like measure from head to toe. Treatment. So you're going to supply growth hormones as soon as possible. Because if you treat this as soon as possible, they're going to have a better chance of being able to grow. So there's something called recombinant growth hormone therapy. It's given subcutaneously injection. You're going to give somatropin. I might be saying this wrong. But somatropin is the growth hormone injection that they need. So the treatment's going to be continued until they're near their final height that they want. So either the child decides that they're tall enough, their growth rate is less than 0.8 to 1 inch a year, or their bone age. So if the male is above 16 years in bone age, you can stop. If the female is above 14 years in bone age, then you can stop. So these are the 3 ways. So they have to decide they're tall enough, the growth rate has to be less than 0.8 to 1 inch a year, or the bone age. 16 and above for males, 14 and above for females. And then nursing management, you want to promote growth. So you want to monitor their growth rate, and it's supposed to be at least 3 to 5 inches within the first year of the treatment. And you're going to measure their height every 3 to 6 months and put it on the plot chart so you can make sure. The second thing you want to do is enhance the child's self-esteem. So you want to tell them to express positive things about themselves and provide information about support groups for other people like them so they can have understanding. You also want to educate the family. Since you're giving subcutaneous injections for the somatropin, you want to encourage rotation of injection sites. You want to report headaches, rapid weight gain, increased thirst and urination, and painful hip or knee joints. Those are things that you want to report to the primary care provider. You want to visit the endocrinologist every 3 to 6 months to monitor growth, adverse effects, and make sure that they're adhering to the treatment. And you want to choose sports that aren't dependent on height, because you want this kid to be able to have a good self-esteem and feel like normal. So you can still put them in sports, just don't put it on like ones that are determined on height, like basketball. Don't put them in freaking basketball. And you want to dress the child according to age, not height. Because this kid could be 10 years old and the height of like a 4-year-old. You don't want to be dressing them in dinosaurs if they're 10. So make sure that that's something.